Every day, Queensland Ambulance receives more than 2,800 calls for help.
He's face planted himself, smashed his nose, he's broken his tooth. Looks like something out of a horror film.
Lighting a bonfire and there's been an accident damage to their hand and arm and face.
Has he ever had a heart attack?
He's had 36 heart attacks.
36?
Yes.
With unprecedented access,
How can we help you today?
we follow emergencies from the heart of the operations centre
My son fell out of his hand on the mail.
to the paramedics on the front line, fighting to save lives.
So lovely to see you this early in the morning.
The early morning shift is starting at the Brisbane Operations Centre. But before work begins, the top priority is breakfast.
Jesus, we're going to be so fat, Kelly.
Let's go.
Let's go.
And on road, paramedics are on the same topic.
Just had a bag of popcorn for dinner last night.
You did a whole bag. Health.
And so I was like, just live life to the fullest while you can.
I don't do any exercise. I'm gifted with very good family genetics.
If there's one thing this job has taught me, it's that exercise is dangerous, so I don't do it.
Never seen anybody die with a hot dog in their mouth.
No, but someone have died choking on a chicken nuggets, so I think there's no safety net. You're gonna die either way.
One day, it'll beat me. But until then, I'm going to eat all the food I want, when I want, no matter what. That's how I live my life to the fullest.
Ambulance, what is the town or suburb of the emergency?
Brisbane, Queensland. So the intersection of Creek Street and Eagle Street.
Okay, so just tell me what's happened exactly.
There's a street accident. Someone's been hit by a car. It's in the middle of the roundabout there. It's a taxi that's hit a motorcyclist, and the motorcyclist is on the road.
Okay, and he's out on the road, did you say?
Yes.
Okay. Is he awake?
I'm not sure. He looks unconscious. He's not moving.
I'm organising help for them now. Do you have any other details?
No, it's a bit of a crowd.
QAS 2 Bravo 501131. We have you proceeding primary, backed up by Alpha 506095, proceeding code 12111 Eagle Street in Brisbane City.
High mechanism RTC. Taxi hit motorcyclist unconscious. Okay. This is a serious one. The motorbike driver is unconscious. He's approximately 40 years old. We're 5 minutes away. I still have food in my teeth. Oh well. The police are already on scene, which is good. Eliza, go and check on the taxi driver. Just make sure he's okay. I'm going to go straight to the guy on the motorbike.
Yep.
Motorbikes never fare well. It's always my fear. I always get nervous with that because, you know, touch is a bit close to home. I always worry when I'm on my bike that someone's just not going to look and crash into me.
Being a paramedic, I see the risks associated with things quite differently, especially with riding a motorbike, because I've seen the consequences of what can happen.
Motorbikes are significantly more vulnerable than cars because in a car you've got a hunk of metal around you. On a motorbike you've got really nothing down there. Parked just right in front of him.
Yeah.
The police are standing with him. They've got him sectioned off. 131, window sit rep, motorbike rider on ground, not moving.
When I started riding motorbikes, I think the best piece of advice I got was ride your motorbike as if everyone on the road in a car is trying to kill you.
We're going to block the whole street off just to keep it safe.
Accidents happen all the time and they can be pretty catastrophic.
Hello. Who's this?
Hector.
Hector. Hector. How are you?
Up and better.
Okay. Hector, my name's Lucy. I'm from the ambulance, okay? Do you know where you are right now?
Yeah.
Okay. Hey, Hector, do you have any pain anywhere?
Knee from the scrape
Uh-huh.
and my shoulder on left side.
The greatest risk for someone flying off a motorbike is that they've damaged their spinal cord. The consequences of damaging your spinal cord can be catastrophic. They can be paralysed.
Okay, so Hector, I'm going to have a little chat to you before I move you, okay? I want to make sure that you're okay. So, do you have pain in your head or your neck?
No.
Okay, all right. And you landed here and you haven't moved since?
Correct.
Okay. Going to have a little feel of your pulse here?
Whenever there is a suspected spinal cord injury,
Couple of deep breaths for me, Hector.
we have to treat worst case scenario and be very careful about how we treat them and how we move them from the road and into the ambulance.
At this time, we're going to look after your neck, okay? Just in the event that you do have a neck injury. Now, we're just trying to get a way to get you safely into the back of the ambulance, okay?
Do you mind if I steal a couple of you? Just wanting to roll him onto our spinal board so we can get into the ambulance and check him out. So what will happen, Lucy's going to be controlling his head just to protect his neck. What we'll do is we'll get a couple of people on this side and we're going to roll him sort of onto the spinal board. We're just going to nice and slowly just so to avoid any injuries.
We're going to try and get you up off the ground, okay?
If we don't handle them carefully, it can definitely cause more damage. We can make that injury much worse.
Okay. All right, so guys, we're going to rotate him. We're going to keep his spine nice and still. So I'm going to manage his neck and his spine. We just need to do it nice and slowly so we don't hurt him any further. So at any point, if it gets too painful or something happens, you yell, okay? All right. We're going to try and get you up off the ground, okay? So whilst keeping your head nice and still, that we're going to look after your neck. Just in the event that you do have a neck injury.
A motorbike rider has been hit by a car in the heart of Brisbane CBD.
I'm going to leave your helmet on just for now until we roll you onto your back. I'm going to support your head.
Lucy and Eliza need to carefully move the patient into the ambulance as he may have a spinal injury.
So we're just about to rotate spinal immobilisation. Okay. All right. This is Hector. Hector, you got all these wonderful people around helping you?
Yeah.
All right. So we're going to put this board in underneath him and we're going to just roll him straight onto the board, okay? All right, Hector, on the count of 3. 1, 2, 3. You all right, mate? Very good. Very, very good. And we're going to take that helmet off, maybe when we get onto the stretcher, actually, because it's providing a good amount of support. And just feeling the back of your neck here, any pain?
There are a few different things that we can do to assess for a spinal injury. Having a good palpation of the area, if there's any tenderness, checking for any loss of sensation in their arms or their legs.
Just squeeze my hands for me. Very good. All right. Other than that pain in your knee and your shoulder, have you got any other pain or do you feel unwell?
I'm not sure about my side.
Around here?
Yeah.
That's a bit sore?
Yeah.
A little bit or a lot?
It's not.
Okay. All your ribs feel intact, so that's really, really good. And your stomach? That's nice and it doesn't feel sore to touch or anything like that? Where is your safety protective gear?
At home.
The one day that you thought you'd go for an ice ride without your protective gear on, hey?
Yeah.
It gets us all. It's a lovely day for a ride.
Yep.
I rode to work this morning as well.
Getting in a car, most people don't even think twice about getting in a car. Riding my motorbike, I am significantly more alert and aware because you just never know when someone is just not going to check their mirrors properly and crashes into you.
All right, we're going to get you onto the stretcher now, get you into the back of the nice air-conditioned ambulance, hey? So we're going to lift.
1, 2, 3.
And
Just watch the monitor. Yep. Loose, watching.
Yeah.
All right, Victor.
Very good.
Down, mate.
Perfect.
You got his neck?
Yeah.
When riding a motorbike, you need to be in the right mind frame because you have to be so hyper aware of every single surrounding.
Few bumps there, Hector.
Accidents happen all the time. And
You can be the best rider in the world. You can be a MotoGP rider. And you still can't control the people on the road that don't do appropriate head checks and just merge into the lane without checking their blind spots properly. Just nice and still, don't tense your body up, okay? Yep, no, I'm happy.
Good stunt fit, hey?
Eliza, can you get that towel?
There's a towel roll just at the back.
If we suspect the patient has a spinal injury, we will always treat worst case scenario. There are many ways to prevent a spinal cord injury from getting worse.
So Hector, we're just going to pop this collar on your neck.
No, you don't move your neck. You keep your neck nice and still, okay? I know you're just trying to help, but we want to keep that neck nice and still. I know this feels weird, but it's going to keep everything nice and in place. And you are not going to go anywhere. Do you feel nice and secure?
Yeah. I'm not comfortable, but under the circumstances.
We're pretty much ready to go.
Yeah, I thought so.
Okay, away we go.
The patient will need scans at hospital to determine the extent of his injuries.
Lucy, do you want to call my wife?
Sure. What is your wife's name?
Sharon.
Sharon, okay. And Sharon doesn't at this stage know that you've been involved in an accident.
All right.
Excellent. This is always fun. Okay.
Tell her not to worry.
Absolutely, I always do.
Hi.
Hello, Sharon. My name's Lucy. I work with the Queensland Ambulance service.
Hi.
I've got your lovely husband in the ambulance with me. Now, first things first, Hector is fine. He's absolutely fine. But he has been involved in an accident on his scooter today.
Okay.
He told me that the one day he doesn't wear his protective riding gear, he has the accident. So we've had a chat about that. We're taking him to the Royal Brisbane Hospital for a checkup, though, just to make sure that everything's okay.
Okay.
Let's just wait to hear a little bit more information, but he's all good for now.
Okay, great. Thanks so much for calling.
No problem, Sharon. There we go. Let's just stay nice and still. The least you move, the better it is, really. You probably need to message your wife and tell her to bring you a shirt when she comes to pick you up, because that one is going in the bin. Oh, we've got to take your helmet too. I forgot about that. It's generally not if, but when you're involved in an accident regarding a motorbike or a scooter. Considering he was wearing no protective gear, he's actually very lucky. But
I hope next time he wears his protective gear.
And always prepare for the fall, not the ride. So it's, yeah, that's a hard one to learn for him.
Yeah.
Hey, Shane.
Yes, dear.
Do you like my new sunnies?
You know what they remind me of?
My sunnies from last year.
Remember the movie Grease? The beautician girl? But those glasses are very similar to the ones that she had in there.
I very much doubt she was wearing $300 Michael Kors sunnies.
So you remind me of a lady who's probably about 70 now.
I've been called worse. I have been called worse.
town or suburb of the emergency? Hello? Hello? What's the town or suburb of the emergency? South Brisbane. And what's the address at South Brisbane? I don't know. I'm on the street. Okay, what street are you on? My son fell out of his on the main road. Listen, I can't get you any help until you tell me where you are.
She just swore at me. Yeah, that's really scary to see a baby so young fall onto the road.
So I could hear him screaming in the background. Poor thing. So I'm just see what the location data brings up.
Around 78% of all emergency calls originate from a mobile phone. Since December 2020, call takers have access to advanced mobile location technology. Even without an address, emergency services can get an approximate location of the caller.
Edmundston, Melbourne. I'm hoping that she is where it's coming up on the map, but
With the location narrowed down to a few streets in South Brisbane, paramedics Shane and Shelley in car 5122 are called to the general vicinity.
Code 1.
Trauma is always very concerning, isn't it?
Yeah, definitely. So donate injuries, donate age.
See what we can find out.
Hello. Did you call about a baby falling from a pram?
okay, all right. So I've already got the ambulance on its way, okay, so don't panic. Know that you're in South Brisbane, and I know you're somewhere around the Melbourne Street, Edmundston Street area. Is that right?
Yeah, I'm at the bus stop.
They're coming as quickly as they can.
Patients at the bus stop. 3-month-old male.
Is that him I can hear crying?
Yeah.
Is he awake?
Yeah, he kept trying to go to sleep, but I kept keeping him awake.
Okay.
And in my career as a paramedic, emotional jobs is pretty much like any paramedic. It's pediatric cases. Always very tough. I actually did a terrible job a couple of months ago.
What was the job?
Just got called to a job for a 30-year-old female intoxicated. So she'd been assaulted by a partner as well.
Oh.
Her 3-year-old son's there holding on to her saying, "You'll be okay, Mum, you'll be okay." And he's just dead scared. Go up to the PA. This took about an hour. And I've made a real connection with this kid by this time. I set up another bed for the kid with an iPad and pillows and blankets, and we watched some Bluey and trying to work out what the hell we're going to do with him.
Yeah.
Then Commswood rang me and said, "I need to go to another job." Went to this other job, arrived back, and he's just looked at me and put his arms out and put his arms around me.
Oh, did you start crying? I want to cry right now.
My heart just broke with him. I just wanted to pick him up and wrap him up and take him home with me. I've gone home many nights and hugged my kids and thought about how lucky I am to have the family that I have. I think being a parent and looking after children gives you a bit of a unique perspective on what that child might be feeling.
Teeny tiny weeny baby.
And I guess I just try and treat every child as how I would hope a paramedic would treat my child, with the same respect, understanding, compassion and empathy. That's what I'd want for my children, so that's what I try and do for everybody else's child as well. So just tell me what happened there.
So I parked the pen like there, like it facing towards the check, and I thought I put the brake further down, but ended up I didn't, and he ended up in the road.
Was he crying?
He wasn't on the road, right? He was like laying still in the pram.
Still in the pram.
But he hit his head, but yeah, he was screaming.
We always have significant concerns when babies hit their head. When they're born, they have very soft spots in their skull, so we need to be aware. Potential of having a significant head injury underneath is quite high in these cases. You look pale, do you?
Yeah.
He does. Yeah, he looks pale to me too.
Yeah.
I want you to bring him to the car, okay? After 17 years in this job, you'd think that you'd probably seen it all, done it all, but I can still say that I still get nervous on jobs. I can still get scared.
Hello.
Look at you, wonderful
He's
kid.
so cute.
Where were you going? To children, and they can go south very, very quickly. They can suddenly go unconscious, and it can be very, very scary. I'm just going to have a little listen to his heart, because you're just about too small for all our equipment, Kingsley. And you've given your mum a fright. This could be cold, Kingsley.
The first.
Excellent. All righty. He's awake. He's alert. There's no sign of any big head injury there.
No, just
However, because he's babies and we're not experts in babies at all, what we're going to suggest is we take him up to the hospital just to be checked by a doctor up there to be safe. It's really important to realise that while you've got a patient there that is suffering, they've quite often got family members around, parents. Those people need reassurance as well.
They're so fragile, though.
Being a father of young children as well, I can really relate to the fears that these parents might be experiencing. Yeah, but you know what? I bet this never happens again.
I hope not. I'm getting a different pram.
You'll make sure that it's secure next from there on, yeah?
Yes. My mum told me she dropped me at least a couple of times, and I believe it too.
Only good parents drop their child because they're holding on to them. A little bit of humour, a little bit of laughter helps to settle things down. They realise that the paramedics are not overly stressed about what's happening, then maybe they don't need to be either.
No, you tired. Go sleepies. Go sleep, baby.
Yeah, there, young man. When I first joined the ambulance service, I can remember spending one night thinking, maybe I'm not cut out for this. Fortunately enough, somebody said to me, you don't need to know it all right now. It's not rocket science. Anybody could do it. It's whether they've got the heart, the caring nature, and the empathy to do it.
Oh, I wish I was that asleep. Having dreams.
As long as he's having a good time.
Long day.
I reckon that's going to deserve a beer tonight.
I think that's absolutely going to deserve a shower beer tonight.
You going to have a shower beer?
I'm definitely.
All right.
I'm going to multitask both showering and beering at the same time.
At the tail end of their 12-hour shift, Shane and Shelley are returning to Wynnum Station.
Good night, everybody. Thanks for your awesome work again.
At the Brisbane Operations Centre, staff heading home have handed over to the night team.
Common call, 2 pending code 1s. We've got one in Kashmir and one in Ferny Hills.
Can I get a hospital for Sherwood? Paul, when you got a sec?
There's a 2-vehicle car accident. She's 37 and a bit weeks pregnant. You want me to just make it a 1 sec? Okay.
There's high demand for ambulances right across Brisbane.
I'm going to tell you how to check her pulse.
Paramedic crews due to finish are going into overtime.
QS Bravo 501191. I've got you proceeding to a code 2 in Sandgate. All right, let's get some help out there for him, okay?
This is the busiest it's been all day. And the problem is we lose crews at 4, 5 and 6. I get they've got to finish sometime. There's nothing we can do. We just send out the available cars that we've got. This is how it happens. It'll be fine, and then boom.
Ambulance, what's the town or suburb of the emergency?
I'm just going through labour.
Okay. What weeks or months pregnant are you?
9 months pregnant.
Are you having contractions?
Yes.
How many minutes apart are your contractions?
Oh, they're very close now.
Very, very close, okay. Okay, I'm organising all you now, stay on the line, I'll tell you exactly what to do next.
Nearly back at station, Shane and Shelley are diverted. They're the nearest available paramedics, 22 minutes away.
Shelley, we're going to one of your favourite jobs.
It's either vomit or it's a baby.
It's a baby.
And there's the vomit. Ugh. Every placenta I've seen has made me gag.
Along with my dislike for vomit jobs, obstetrics is the other type of job I don't like. Any job that comes through where I think we could deliver a baby, I don't particularly want to go.
Water just broke.
Okay.
Oh, yes.
Water's just broke.
Oh, no.
She's in labour. It's full term, second delivery.
Oh, so it's a real baby.
Contractions are less than 2 minutes apart.
Already regret the words that I'm about to say. We're going to deliver this baby.
I know babies are cute and they're jobs we don't go to very often, but they're also really high risk. I always have a little bit of an unsettled feeling because there's so many things that could go wrong with the delivery.
It's like I've been to one who was like in imminent labour, but she could not give birth naturally, and for some reason didn't show up for a C-section that morning, waited till her waters broke at home and then called an ambulance.
So where are you now?
Outside on the patio.
Okay, just go back inside. I want you to lay on the ground. I'm going to help you deliver your baby, okay?
Is the baby coming now? Is it coming now?
It could be, yes.
I have never, ever seen you put your gloves on so early before a job.
I'm so ready for this.
Yeah, catch it.
I don't want to have the baby at home.
We're on our way. We're coming lights and sirens, so we're coming as quickly as we can, okay?
Hypothetically, if we were to deliver Shano, what number baby is this for you?
This would be number 4 for me if we delivered.
4?
Yep. So it's been about 5 years since I've done one.
Well, there you go. I've done 2 in the last 12 months. You got this one, don't you? I'll stay in the car.
There's another one coming.
There's another contraction coming.
Oh, far out. My back is sore. Will they be able to give me any medication now too?
They'll be able to help you with that.
Oxytocin's just IM, isn't it? And it's just the whole vial, yeah. That's after bub, pre-placenta.
Doing good, doing really good, okay?
The contractions are getting closer together.
Mate. Baby's coming.
Shane and Shelley are still 6 minutes away.
What number is it? That doesn't feel like enough gloves. That still doesn't feel like enough gloves. Not enough gloves in the world.
They literally should be pulling up.
Oh, 36. Do we just go past it, or is it this one?
I'll grab a kit and go and see what's happening.
I'm going to take my jumper off because I don't want to get baby juice on my sleeves.
Let's just go and see what we got, Shelley. Hello, my name's Shane. I've got Shelley down in the car.
Oh, I'm puffed.
Oh, it's a second baby?
Yeah.
You're full term?
Yeah.
We're in between contractions, it's a good time to go.
Our stretcher's just at the bottom of your front stairs. Oh. Hello, little one.
Who's this little fella? Is this the other one?
Us?
And he was a normal delivery?
Yeah.
He was all good, no complications? When we get to somebody that's in labour, we do a very quick assessment, and if we deem that it's safe to, we get the patient on board as quickly as we can. We're always thinking about all the complications that can occur. So no problems with diabetes or your blood pressure?
No. 122 case as given. However, this patient's contractions are, however, about a minute apart. We will be heading up to hospital shortly. Oh.
Let's go. What are we doing?
Oh. Have you got a blue book at all?
No, the book. I can't wait for the book.
Are you Mum? Congratulations, Grandma.
We can go.
Yep.
This is so sore.
Is it mainly sore down low? Yeah. I'm just going to gown up, Shelley.
Oh, can you see something?
A little.
My back, eh?
Yeah.
We're still like 20 minutes away, Shane.
The contraction's that close. Don't worry, it won't be the first baby that's born in an ambulance.
Oh, my God. This is up.
Let me know if you want me to pull over.
All right.
1, 2, 2. Her contractions are a minute apart.
My back is really sore, eh?
Is it?
Can you see something? We're still like 20 minutes away, Shane. Let me know if you want me to pull over.
Shane and Shelley are transporting a patient who's in the last stage of labour. As they may not reach the hospital in time, they're preparing to deliver the baby in the ambulance.
Have you had the oxytocin chat just in case?
If we do happen to deliver this baby in here, we have a little injection we'd like to give to you after the baby is delivered. It's called oxytocin, just to help to promote the delivery of the placenta and to help stop the bleeding. I'll see how we go. But I'm hopeful that I won't have to.
Oh, it's so uncomfortable.
Yeah. I did do my first baby ever just up here a bit further, Shelley.
Oh, could be deja vu.
Oh, my God. This is up.
What do you mean it's up? It's an exciting time. All very exciting, don't you think? And you said it was a boy?
Shane. Shane's very, very calm and always keeps that demeanour, but Shane is the last person I would want to deliver my baby.
Well, everybody's very quiet in here tonight. All waiting with a bated breath.
He is so funny, the things he says to pregnant women. I don't know how he hasn't been hit yet. I find women in labour don't usually want to have a joke.
It's coming again.
Mm.
Oh.
Do you feel like pushing yet?
Nah, I just want to get the out of me.
Yeah. Alrighty.
Oh.
No baby yet. We're all good here. We're only a few minutes from the hospital now. I think we're going to be right, Shelley.
Put this baby out of me.
Well, I can see the hospital now. We're almost there. Pretty sure we're going to make it.
To the car park, at least.
You did have me concerned there for a minute. And we are here. I'm not going to need this gown. How lucky was that?
All good, Shano?
Yep.
Oh.
I think we're good now.
Waters are broken, contraction against the heart. We could go. Thanks, bud.
And I was in the job 12 years before I did my first baby. But then I did 3 babies in 3 months.
Hey, Epi.
Talking.
The good does far way out the bad in this job.
You're going to have beautiful little baby snuggles soon.
The joy of seeing a new baby come into the world is just something you can't describe. I think you just get a thrill out of this job and a sense of reward that you just don't get anywhere else.
And that's a happy ending. My favourite line that you say to every woman I've been to you with who's like in labour, you're like, it's not as fun having him as it is making him, is it?
I thought about that,
Like
but then I went, nah,
I think,
I won't do it.
yeah, I think she would have punched you straight in the face. And I just would have laughed.
Shotgun.
Oh, okay.
It's 7 a.m. Lucy and Eliza are one of more than 250 paramedic responders heading out in Brisbane today.
What a beautiful day, Lucy.
It is. Lovely day to wash your car.
Ambulance, can you tell me exactly what's happened?
Okay, I've got a 101-year-old client who's having trouble getting out of bed and he's in quite a lot of pain.
A medical alert agency has called on behalf of an elderly patient.
He does sound quite distressed, so I'm not sure whether there's something else going on there too.
And we'll just reassure him that help has been arranged.
So, Lucy, we are on our way to a 101-year-old male. He's having trouble getting out of bed and is complaining of hip and back pain.
Have you still got him on the intercom?
Yes, I'll stay on the alarm till help arrives.
What a pro.
I am quite passionate about the elderly living independently in their own home for as long as they can. Older people, I think, are scared to go to hospital. They're scared that they won't come home. They're scared that they'll be put into a nursing home, that they're going to lose their independence. I could only imagine it would be so scary and unknown for them.
Knock, knock. Hello. Oh, hello.
Hi.
Hello.
Hello.
Hi.
I haven't got my hearing aids in.
Oh, okay. Whereabouts would they be so we can pop them in?
They're in that bedroom.
Found them. Here you go. Is that on?
No, yeah, it's turned on.
Lucy and Eliza are with a 101-year-old patient who called for help using a personal medical alarm.
There's two.
There.
Now we can start again.
I can hear.
Yeah, we can hear you now. My name's Eliza. This is Lucy. So what's giving you some grief today?
It's the hip and leg and onto the back.
Oh, I see. Okay.
Yes.
And this morning you couldn't get out of bed because of that pain in your hip, so you called us to help?
See, that's swollen up there.
Oh, yeah, it does look a bit swollen, doesn't it?
I've got arthritis, a bad one now.
Yeah.
I love going to elderly patients. Elderly people still living at home are such a vulnerable population. Sometimes they just need a little bit of extra care and support.
Now, Arthur, would you like to go to a hospital today?
No.
No.
Turn the kettle on.
Turn the kettle on.
That's right.
Recommend you take your Palexia, and I think we should take it with some Panadol as well. How do you like your cuppa? With plenty of milk?
A little bit of milk in it. That'll do.
That'll do.
Where's your letter from the Queen?
Yeah.
Get them down there. There's a few of them there.
Can I have a look?
Yeah, look at them all.
Oh, thank you.
I always take my time with elderly patients. I think they deserve the time spent on them.
Majesty's congratulatory messages to Australians.
Patients won't specifically remember what you do for them, but they will remember how you make them feel.
That's pretty special.
Everyone that sees it, they want to take a photo of that.
Do they?
That's the one I like the best, when I that letter.
Can I read it out loud?
Yeah.
That's okay? I wish to extend to you my warmest personal congratulations and best wishes on the celebration of your 100th birthday. On behalf of all Australians, I want to express our gratitude for your service during World War II. You have lived through remarkable and often difficult times. On this very special occasion, please accept our heartfelt thanks for the part you played in securing the freedom and way of life of all Australians enjoy today. With sincere wishes, Minister for Veterans and Personal Defence.
I thought it was nice.
That is a really nice letter. Yeah.
I got married during the war.
Did you?
I was home for a few days, and so I got married. Went down and said to her, "Will you marry me?" And she said yes.
How lovely.
And she lived with me then till 1999.
That's a long time. Yeah, wow.
Died in her sleep.
Oh.
Yeah.
You're walking very well. I know it's a bit sore, but you're still doing very well.
Like nearly 1 million older Australians, Arthur receives community health services at home.
My name's Lucy, I'm from the Queensland Ambulance service. I have one of your clients. Just wondering if we could get an appointment for him today or tomorrow. Just needs a little bit of extra help to keep him at home, which is what he wants ultimately.
That's my photo there.
I think when it comes to the elderly, a lot of people can overlook their abilities. I think it's very easy for people to forget that they were once young, strong and fit, just like you or I.
I was only about 21, I think.
So young.
There's the stripes on it, see?
Yeah.
For a corporal.
For corporal.
You wouldn't know me now. Just for the photo.
You got the same eyes, I think.
I don't know how I'll keep to to be 100.
What's your secret?
Just lucky, I think.
Just lucky, hey?
Yes.
So the physiotherapist is going to come and see you today. They're coming at 1:45.
All right.
Okay?
Okay, thanks. Thanks very much.
That's all right.
Okay. Is there anything else that we can help you with today?
No.
No. Are you sure?
Thank you. You've been very marvellous. Thanks very much.
At the end of the day, it is about improving their quality of life and keeping them at home and in their familiar environment as long as we can.
You make sure you have a very big party for your 102nd birthday.
Yeah. Well, I don't see why I shouldn't.
That's it. See you, Arthur. Lovely to meet you.
See ya.
He was the sweetest. At 101 years old and he's still living on his own.
That's so impressive.
Yeah. I hope 102nd birthday is a big one.
I want to go to his 102nd birthday.
Yeah. I hope they get his arthritis fixed in time for him to do some dancing.
It'd be so cute.
Yeah.
Let's go get the next one.
Yeah. Got my cheap sunnies. It's better than nothing.
I've been a paramedic for 8 years. I meet people every day at work. The most common response is, "Oh, I could never do your job. It must be so hard."
Perfect. Hello.
And I always like to turn around and say, well, no, it's actually the greatest job in the world.
Can I listen to your lungs? Yeah? He's very good.
He is.
I enjoy the excitement of being able to help someone in their immediate need.
You'll be okay though, and take really good care of you.
When an ambulance arrives, when they're unwell, most people look at you and have this look of relief on their face that you're actually there to help.
Just try not to shake and nod your head.
Strangers let us into their house They let us into their most intimate places and moments. We can just walk through the door like we live there and walk into someone's bedroom, sit down beside them and start having a chat. And I think that's pretty special.
Good. Wrong finger. That's the one.
Smile. 1, 2, 3.
Being part of the ambulance service is more than a job. And I know that sounds a bit corny, but it's genuine. When my day's done, I can look back and go, I'm really proud to be a paramedic.